morning, everyone. My name is Gabrielle Mills, and today I'll be doing a mental health presentation on coping with Alzheimer's disease. I'll give you a lot of informative information regarding coping skills, whether you're someone who has Alzheimer's disease, a family member, or also a caregiver of someone with Alzheimer's. Let me go ahead and share my screen with you all. Okay. All right, so what is Alzheimer's? Alzheimer's is a progressive mental disease. This deterioration in the brain happens during middle or old age. This deterioration affects our memory, thinking, and also our behavior. And Alzheimer's is also the most common cause of dementia. It causes about 60 to 80% of dementia cases. And dementia, if you don't know what that is the general term for loss of memories, language, problem solving, and other thinking abilities that are severe enough to interfere with our day-to-day lives. All right, so moving on to the stages of Alzheimer's disease. The first stage is mild cognitive impairment. This stage lasts 7 years and also begins in the medial temporal lobe. The medial temporal lobe does control new learning abilities, new information, and holds the place for all of our older memories as well. So any interference with this can have us going through memory loss. Stage 2 of Alzheimer's disease is known as mild Alzheimer's. This lasts about 2 years, and this is when the disease spreads to the lateral temporal and the parietal lobes. So in the parietal lobes, they're responsible for processing sensory information it receives from the outside world, mainly relating to touch, taste, and also temperature, and damage to the parietal lobe may lead to dysfunction in our senses. So it might be harder to feel things, taste certain things, or know that you're hot or cold. You'll start to have some difficulty with that. And the lateral temporal is critical for our language comprehension, visual processing, and facial recognition. So in this stage of Alzheimer's, it's not uncommon that someone would not really recognize you for who you are. The third stage of Alzheimer's disease is moderate Alzheimer's. This stage also lasts for about 2 years, and this is when the disease spreads to the frontal lobe. So the frontal lobe is responsible for our behavior, and is our emotional control center, and it also is home to our personality. So personality is a big part of who you are as a person. Therefore, any kind of interference in the frontal lobe will start to, affect our personality. You might seem off to others, or you might be feeling a little off yourself as well. Lastly, is the severe Alzheimer's stage, which lasts about 3 years, and this is when the disease spreads to the occipital lobe. So the occipital lobe is responsible for our visual perception, including color, form, motion. Damage to the occipital lobe can include inability to recognize movement of an object or difficulties with reading or writing. And that's a big part of your everyday life. So you see why it would be severe Alzheimer's stage when if your reading and your writing is affected, because that's something you would need to use every single day. Now on to the symptoms. So the symptoms come by stage. So in the mild cognitive impairment stage, there's a short-term memory loss. So if someone said something about 5 minutes ago, someone with Alzheimer's, it wouldn't be uncommon for them to ask a question again that they just asked 5 minutes ago. Also, in mild Alzheimer's disease, it's not uncommon that you'll start to have reading problems, poor object recognition, or a poor sense of direction. It may be easier for someone with Alzheimer's disease to get lost or to not know where to go at certain places. It'll just be easier for them to, get lost. Also, in moderate Alzheimer's disease, some of the symptoms will include poor judgment, impulsivity, and short attention. So, impulsivity, excuse me, is a big one because impulsiveness can definitely be a risk and put people at danger. So, you definitely want to pay attention to that if you're a caregiver or a family member of someone who has Alzheimer's disease and they're in the moderate Alzheimer's disease stage. Lastly, in regards to severe Alzheimer's disease, they can begin to develop visual problems, and this is also important too because that can be imperative to your everyday life. Next, what happens in the brain during Alzheimer's disease? So a lot takes place in the brain during Alzheimer's disease. First, plaque starts to build up in the brain. This is due to a protein called beta amyloid. It shows up in irregular clumps or kind of like clusters in the brain. And this protein comes from a precursor protein found in the fatty membrane that covers the nerve cell. And the clumps and the clusters start to stick together and they form what we know as plaque. So these sticky clusters intercept the signals between the synapses. And if you don't know, the synapses are the spaces in between the brain that kind of allow signals to go back and forth. All right, so then there's the protein strands and threads that can become tangled. In a diseased brain, the protein strands and threads kind of become tangled. And as a result, the brain system that's like kind of transporting cells and along with nutrients and parallel structures can start to fall apart. So once the threads become tangled, everything kind of starts to eventually fall off track. There's also cell loss that takes place, which is not good at all. Without the critical nutrients, the brain cells can start to die. So this results in cell loss. Lastly, and most severely, the brain can begin to shrink. So in advanced Alzheimer's disease, the surface layer that covers the cerebrum is the largest part of the brain begins to start to wither away and shrink. So that is also a negative thing that can happen. The damage to the cortex plays a big part on the brain and can affect a person's normal ability to plan ahead, recall information, and even concentrate. So that can definitely, affect one's everyday life habits. Next, who does Alzheimer's disease affect? Alzheimer's disease affects more than 6 million Americans, to date. And Alzheimer's disease also affects adults ages 65 and older. Yes, you can be younger than 65 years old and develop Alzheimer's disease, but it is less common. Also, who is most affected by Alzheimer's disease? The minorities that are mostly affected are African Americans. They're the number one group that's affected by Alzheimer's disease. Then followed by Hispanics, non-Hispanics, and then American Indians, Alaskan Natives, Asians, and Pacific Islanders. They're the minority groups that get develop Alzheimer's disease the least. Lastly, in regards to women and men, women do outnumber men when it comes to Alzheimer's. It's about 2 to 1. And also, however, although it's about 2 to 1 when it comes to women and men developing Alzheimer's disease, women are most likely to live longer than men if they both have developed Alzheimer's disease, which is a surprising fact, which based off the research that I did, there wasn't any true backing or research yet that proves just why that is. Next, moving on to the experience of having Alzheimer's disease. So for your loved one, or if you're someone who recently has been diagnosed with Alzheimer's disease, it's normal to experience confusion, anger, maybe depression, mood swings, irritability, or even experience fear. It can definitely be difficult since you're learning that have developed a new disease, or learning that a loved one has developed a new disease, can be something that's hard to do. So it's definitely important that you know that this can happen if you're a family member or a loved one, that they will be experiencing these emotions, and also to you can don't be frightened or startled if you sense that your loved one's starting to feel this way based off what they're going through. It can be a confusing and difficult time to just process while they're processing that information, but make sure you're there for them during that time. So Alzheimer's disease and diagnosis does not just affect the individual, it could also affect their family members. It's very common that family members will have feelings of sadness, some feelings of denial, feelings of fear, and also feelings of hope as well for some. And it can cause families to, make arrangements, figure out what they can do, how they can help their loved one, and how they're gonna move, how they will move, um, after learning this diagnosis, and how they can best plan to assist their loved one in their new lifestyle coming up, that will be coming up over time. So those are the multiple ways that family members can react to the diagnosis. Here is a great video for loved ones that are caring for someone with the diagnosis of Alzheimer's disease. So I'm just going to play this video. It does give you a lot of great information, and I'm just going to let you guys get some of the tips and information that they give that will be very helpful.